Good morning from the Oklahoma Insurance Department. My name is Wyatt Stanford, and I work in the Communications Division here at OID. Thank you for joining us for our Medicare Monday webinar series. For your awareness, I do want to mention that this webinar is being recorded. Before we get started, I wanted to share a little bit about what the Oklahoma Insurance Department, or OID, does. OID is a state agency, and we are responsible for regulating the insurance market and enforcing the insurance-related laws of the state. We have an entire team devoted to protecting consumers by providing them with accurate information and timely assistance. We can also deal with your insurance company if you cannot reach an agreement regarding a claim. If you would like to reach out to us for help or if you have any questions, you can call us toll-free at 1-800-522-0071. And you can also visit our website at oid.ok.gov. For today's webinar, you'll be able to see and hear us. However, we cannot see or hear you. If you have a question, please type it in the chat. At the bottom of your screen, you'll see several options, one of those being chat, and if you click on that, you can type your question there. We will save time to answer questions at the end of the webinar. Now I'd like to introduce our speaker, Ray Walker. Ray is the Divisional Director for the Medicare Assistance Program at the Oklahoma Insurance Department. Mr. Walker has over 20 years of experience working in and around the healthcare industry, primarily in insurance, and has the privilege of speaking to groups across the state and around the country. Ray, now over to you.
Good morning, everybody. Thank you, Wyatt. I appreciate Wyatt stepping in. Rachel is taking a little bit of time off, and Wyatt is always so generous to just jump in whenever we need him, and I appreciate that very much. Hope everybody had a great weekend and is enjoying the weather. I'm having a little bit of trouble adjusting to the heat right now, and I find as I get older, it's a little bit more difficult to adjust every single day. So, speaking of hot topics, let's jump into today's topic as well. But before we do, I want to remind everybody that the Medicare Assistance Program is a program that is funded through federal grants through the Administration for Community Living. And we provide education and assistance to beneficiaries, their family members, and caregivers related to Medicare. We want to help people understand what their Medicare does and how it works and how to get the most out of it. We also help people with issues related to Medicare fraud. And to do this, we partner with agencies around the state to provide this education and assistance. So if you have any questions related to Medicare or about Medicare, please don't hesitate to give us a call. Our contact information will be available at the end of this webinar. Now let's jump into our topic for this week, which is Medicare fraud. Want to let everybody know this is Medicare Fraud Prevention Week. Medicare Fraud Prevention Week occurs every year. It falls on the week that includes, June 5th. That is because whenever they were coming up with this idea of Medicare Fraud Prevention Week, they thought it would be a great idea to make it the week that includes June 5th because 6/5/65, get it? Ba-dum-bum. Okay, so the week that includes June 5th is always Medicare Fraud Prevention Week. So this year, that is the week of 6/1 through 6/5. All right, that's the week that we want everyone to take an active role in helping spread the word that Medicare fraud is still a huge, huge problem in our country that we all need to take an active role in trying to prevent. It is a much more cost-effective process of preventing Medicare fraud than it is trying to collect money that has been lost to Medicare fraud on the back end. So what we're going to focus on today is ways that we as consumers, as seniors, as caregivers, as loved ones, what we can do to help prevent Medicare fraud and just learning about what this problem is and what we can do. So our program, the Medicare Assistance Program, we get a grant every year from the Senior Medicare Patrol. This is one of our grants from the Administration for Community Living, specifically to work to educate people about Medicare fraud. So the S&P grant, what we're trying to do there, it empowers us and assists Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. All right. We want people to know and understand what they can do to fight fraud. This is a preventable problem, folks. This is something that we can, in fact, have a significant impact on. It, as I said, it's funded by grants to the U.S. Department of Health and Human Services Administration for Community Living. The program started way back in 1997. And since that time, it has grown significantly. We've done a lot of different things. There's one in every state, in every territory. Uh, we work through different entities, through different organizations. We do all sorts of events to try to do this kind of education. And yet still the challenge persists. We still have a massive problem. It is estimated that $60 billion, that's with a B, folks, $60 billion is lost every year from Medicare fraud, errors, and abuse. All right, that's money that's lost out of the Medicare trust fund for no reason whatsoever. It's not going to healthcare. It's not going to prevent cancer. It's not going to treat somebody's diabetes. It's just gone. All right, that's a huge problem. And it's estimated there was a big event in Florida not too terribly long ago. This was a combined event with people from ACL as well as from CMS. And in this event, they had some of the people from the federal government, people from CMS and stuff that spoke, and they were talking across healthcare systems that are funded by the federal government. So this included not just Medicare, but other programs, TRICARE, VA, other programs that pay for healthcare out of federal dollars, taxpayer dollars. It's really closer to $100 billion that are lost annually because of this problem. So it's a huge issue. We've got to address this problem. Who is committing this crime? You know, we obviously think of the bad guys, the transnational criminal organization, and that is a problem. There are big crime organizations that are involved in this, many of which are overseas. And one of the reasons why this is a problem is because once that money leaves our country, it's gone. We're not going to get that money back. But also, there are entities within our country that are involved in this fraud. Medical equipment suppliers. You hear about these reports on the news on almost a daily basis. Medical equipment suppliers and facility owners that are getting caught with their hand in the cookie jar. Medical professionals. You know, for a claim to get paid out of the Medicare system or from TRICARE or VA, there has to have been some physician who signed the order. So there are medical professionals that are also getting involved in this. Now, why is this still a problem? Why are we still dealing with this? I mean, my gosh, what this, this program started in 1997. They were trying to address it through law enforcement way before then. In a word, it's the size of the system. Think about it, folks. Medicare processes over $1 trillion in payouts annually across over 1.4 million providers. That's just the providers through numerous payment systems. So there's multiple different payment systems. When you think about it, the reimbursement mechanisms, the mechanisms that Medicare uses to pay the various different kinds of providers they've got, there's prospective payment systems, there's value-based, there's fee-for-service, there's all these different mechanisms. And then within those mechanisms, there's different payment systems that they have to use to pay those providers, okay? On top of that, it's a very complex payment system. Currently, there's 69.7 million Medicare beneficiaries. That number is growing by 10,000 new Medicare beneficiaries every day because we're still dealing with the baby boomers, and we will be for a little while now. So the number of Medicare beneficiaries is growing at a huge rate every single day. So the size of this system is phenomenal. Coupled with that, the federal and local law enforcement entities that are tasked with trying to fight this battle are constantly having to deal with staffing and funding shortages. It is an uphill battle at all times for these people to try and keep up with the people that are trying to commit this crime. Now, another thing that we need to focus on, people, every person on this phone, whether you're a senior or not, is that Medicare fraud hits us all. This is not just a problem for us old folks. All right. Every single one of us is a victim of Medicare fraud. All right. It drains billions of dollars from the federal trust fund that is the Medicare Trust Fund. Tax money. It increases our taxes because they're going to have to replenish those funds. All right. They have to come up with a way of extending the life of these funds. It increases healthcare costs and premiums. As you well know, the Medicare premiums every year go up. And as they analyze how much do these premiums need to go up, one of the things that impacts that is the drain that is being put on that due to fraud. Additional impacts that impact Medicare beneficiaries specifically, however, are one, the reduced quality of care. Okay. The care that they're receiving can also be impacted by this because if there's something on their medical record, let's say that there's a claim that hit their Medicare record that would indicate that they have some condition, some illness, a past history of cancer or something like that, that is incorrect. It can impact the quality of care because there may be a treatment that that person could benefit from, but if they had in fact had cancer in the past, they wouldn't qualify to receive that treatment. Does that make sense? So that's one of the ways that it can impact a person's record if that false information is on their record and it didn't get reported. Compromised personal medical records. If that information is contained on somebody's personal medical record, somebody filed something that looks like they had a condition that they didn't have, it impacts maybe their ability to get life insurance at some point down the road. Billing and financial headaches. If somebody files a claim that makes it look like they received some service and somehow that doesn't get reported, at some point in time, it may not pop up that they have a copay or something at the time that it first got entered into that system. But we have seen situations where down the road, years down the road, something pops up in a hospital system or something like that, and they think, oh, nobody caught this. We should have collected a copay or co-insurance for that. And somebody pulls it up, and all of a sudden the person is like, I thought I already dealt with this. That was fraud. We reported it. We did everything that we needed to do. Why is this coming up again? But it can happen. So that's one of the reasons why we try and get people to be vigilant, find these things immediately and get them reported so they can keep your records clean. So let's talk very quickly because we talk about fraud, errors, and abuse. Now, while there is a difference between fraud, errors, and abuse, the impact to the beneficiary can be exactly the same. So it's still important, whether it's fraud, which is a crime, or errors or abuse, it doesn't matter. The impact it can have to the person is just as bad. So let's talk about what's different about them. Mainly, it's intent and knowledge. So fraud, of course, we're pretty much clear on this. It's intent. The intentional executing and attempting to execute a scheme to defraud the Medicare program or obtain information by means of false pretenses, deception, or misrepresentation. They were trying to commit a crime. They knew what they were doing. They wanted to get money that didn't belong to them. All right. Errors. It's the unintentional billing errors, such as billing for services not received or double charges for one service. These are errors that can easily be corrected. It's a mistake. It's a boo-boo that was done at the doctor's office. They accidentally used the wrong code, or they weren't precise enough. These codes can get very, very specific for the services that were rendered. Or they might have used a code that was a little, for a higher service than the one that the person really received. And so, it wasn't intentional, but they accidentally did it. That could be considered a medical error. These are things that if you catch it on your Medicare summary notice, your explanation of benefits or something, and you turn it in, these can be corrected. All right. Maybe you got double billed. They charged you for 2 visits when you only saw the doctor once that month. Report these things. The doctor's office can correct it, and all is well. So, what's Medicare abuse? Medicare abuse includes practices that result in unnecessary cost to the Medicare program. Okay. This is any activity that does not meet professionally recognized standards or provide patients with medically necessary services. Okay. Now, this could be a situation where, let's say that somebody was working at a doctor's office and they were accidentally using the wrong code to bill for an office visit or a certain procedure or something. And at first, it was a mistake and they accidentally got reimbursed too much money from Medicare. But then as a result, they didn't correct it, and they realized, well, okay, I didn't look up the right code, but it went through. So, who does it hurt? What difference does it make? That's when it starts rolling into the possibility of being abuse. Okay. So is it abuse? Is it an error? Is it, were they really trying to overcharge? So how do we know the difference? Who's going to make this decision? When you get to the point where you're trying to decide, so was that a mistake or was that abuse or was fraud? I mean, at what point in time do we get to that point? The only one that's going to be able to tell you whether this was fraud, an error, or abuse is going to be the federal authorities. And when it gets to the point to where they're involved and they're making the decision, I don't think I want to be there. So really, on the professional side, it's a great idea that if you get a phone call from somebody and they're asking you questions about their bill and stuff, you want to make sure that the records are clean and that you've reviewed it and that you make sure that everything is on the up and up. All right, so let's talk very quickly about a few of the cases that have come up recently. In the past, when we were doing this, we would talk about some of the professionals that had been included in this. We've actually got some that were here in Oklahoma, unfortunately. In 2025, typically once or twice a year, we'll hear about a rather large uh, arrest or a large case that comes up from the FBI and other large law enforcement agencies. And in 2025, the National Healthcare Fraud Takedown. This came from the U.S. Department of Justice. There were nearly 500 defendants. This included physicians, nurse practitioners, pharmacists, and some other licensed professionals. There was like chiropractors and people like that. And this involved the submission of over $14.6 billion in false billings. It also included 15.6 million pills of illegally diverted controlled substances. So this was a big bust, all right? And again, so this is a law enforcement action that took place involving providers from across the country. And I mention this because often when we're talking to someone about their specific fraud report, when we're talking to one of you guys and you're telling us about your specific fraud case, we're very interested. We want to know what happened. We want to know, hey, I've told you about this instance of where I think someone's committed fraud against me. Let me know when the guy gets caught. Sometimes we don't know. Sometimes it may take a while before anything happens that particular company uh, gets caught, for lack of a better term. Or it may be that company is going by a different name or something like that. So I want you to see this because there's no telling how long some of these 500 defendants were being investigated and they didn't even know it. Because some of this has been going on for years. Like I said, this was in 2025, all right, when this actually happened, that all of these entities got indicted, all right? One of the ones in question that we're going to talk about today, this came out of the Southwest Ledger. This was on Tuesday of July 8th of last year. a physician in Oklahoma City, and Alexander Frank. This was on June 2025. He was indicted on 25 counts of healthcare fraud. There were multiple indictments. One billed Medicare for approximately $3.2 million for face-to-face visits at skilled nursing facilities that never occurred or were only partially rendered. For example, there were 72 claims for face-to-face services provided on February 10th of 2022. So this is 3 years earlier. They totaled 35 hours. So on February 10th, he provided 35 hours of services. And there's 24 hours in a day. Okay. Furthermore, the beneficiaries that he provided services to lived in Durant, Wewoka, Broken Bow, McAllister, and Eufaula. So he was face to face with individuals who were in skilled nursing facilities in 1, 2, 3, 4, 5 different towns. Wow. Okay, but there's more. Also in 2022, he submitted claims to different insurers. This isn't just with Medicare, this is different insurers that cumulatively amounted to 8,372 hours of face-to-face visits. That comes to 23 hours every single day of the year. This is a dedicated man. Also, Dr. Frank submitted claims for treating a patient at a Lawton nursing home on November 5th of 2022. According to the notes, it was a comprehensive assessment of and care planning for the patient who had a cognitive impairment like dementia. What was interesting is the patient he billed for had died 4 months earlier. So I think I can understand why there was a cognitive impairment. Another physician in the same bunch of those 500 providers was a Dr. Ladd Clayton Atkins. This was a doctor in Tulsa. He was charged for his role in this national healthcare takedown. His was more drug related. He was accused of unlawfully prescribing Adderall, which is a Schedule II controlled substance, and for distributing this substance that he wasn't supposed to be distributing. So along the same lines, but this one related to medications. Now, more recently, a physician in Cushing, and this was just in January, Mark Loftus in Cushing, Oklahoma, was indicted for a $30 million scheme involving back pain home supplies. All right. The company that he owned was Back Pain Home Supplies, LLC, but they were doing business as EZ Medical Supply. So again, this ties back to what I said earlier. You may report to us a fraud case under one company. In this case, it might have been EZ Medical Supply. So you're watching to see, in the newspaper, on the news or whatever, something called EZ Medical Supply, when in fact the company that this person owned was Back Pain Home Supply. So again, the day may never come that you actually see EZ Medical Supply in the paper. You may not. What you want to make sure of, and what's important to you as a Medicare beneficiary, is that you're getting your record clean, that you're playing your role in keeping the Medicare trust fund safe. So yes, it's always great when we can see ourselves catching the bad guy, but just remember, it may happen, it may not. In this particular case, these are all, by the way, still under investigation. It's probably going to be years that these are all still in court. So just be aware of that. Now, so what can you do? This has been our mantra since we started the SMP program back in 1997. We want people to prevent, detect, and report fraud. When we talk about preventing fraud, there are specific things that you can do. One, don't give out your Medicare number to anybody unless you know they need it. This is going to be the hospital when you're checking in. This is going to be your doctor's office when you're standing there at the doctor's office and you're about to see the doctor that you need to see. This is not the knee brace people that just happen to call you on the telephone to see if maybe you could use a knee brace. All right. Nobody calling you on the phone needs that Medicare number unless you know for a fact that that person on the phone is who they say they are. Maybe you are going to have a knee surgery or a hip replacement or something like that. But if you don't 100% know for a fact that that person on that phone is that hospital where you're going to be admitted, don't give it to them. In fact, you can hang up the phone and call back on a phone number that you know goes to that hospital if you want to, just to make sure. Don't be giving that number out to anybody. Folks, these scamsters can spoof your phone number. They can spoof the number to make it look like they're calling you from any hospital they want to. Don't carry your Medicare card unless you will need it. Okay, there's no reason why you have to carry your Medicare or your Social Security card for that matter with you at all times. Keep them at home in a safe place. Keep them in a safety deposit box if you want to. If you're in an emergency, if there's a car wreck or something, they're going to treat you. Okay, and you can give them that information later on. Now, Medicare will never call or visit to sell you anything. There's a lot of people that will show up at your door claiming to be from Medicare or Social Security or something like that. Don't believe them. They're not going to show up. All right. Be very cautious of any free medical services. In the past, there's been people that have gone out shopping or something, and there's a booth that says free diabetes check, free blood pressure check. And they say, sure, all we need is your name and your Medicare number. Nope, they don't need your Medicare number to do your blood pressure check. All right. The only reason why they need your Medicare number is to bill Medicare or to steal your identity. If it's free, it's free. They don't need anything from you. All right, second step, detecting fraud. Use your healthcare journal. Folks, if you don't know what a healthcare journal is, I can tell you. These healthcare journals, and we give them out for free, are available through the Oklahoma Insurance Department. Just give us a call. We will send you one in the mail. We give them out at our events. This is a place where you can keep track of all your doctor's visits, what they did, what they told you, when you were there, all the important information. And then when you get your Medicare summary notice from the people at CMS, you can compare the information on that Medicare summary notice or your explanation of benefits to the information that you've written in your healthcare journal. And that way you can know if everything is correct. It's like balancing your checkbook is exactly what it is. So this is a great way to know if the information is correct. All right. Now, there's another place you can look other than the Medicare summary notice, and that's on Medicare.gov. And here's why I mentioned that at this point. There has been a big change that has occurred. The paper Medicare summary notices that we're all used to receiving in the mail used to get mailed out every 3 months. That is no longer happening. As of this year, CMS has changed that. They are now only going out every 6 months. That is a huge change. That means if there is a incorrect charge on your Medicare summary notice, you're not going to see that for 6 months. So it's very important that you are checking that if you're continuing to use that paper Medicare summary notice. Now, the alternative to that paper notice is to sign up for a Medicare.gov account on the Medicare.gov website. It's easy to do. You get a username and a password, and on that website, you're actually able to see claims that are processed in practically real time. You can see them every month. You see them even faster than you would with the paper Medicare summary notices in the old days. So it is a very fast way of seeing it. However, we do have a lot of seniors who just aren't comfortable using computers. If you're not, if you've got a family member that you trust that can set up an account for you, that would be great. Um, if you've got, a situation like that, but don't let somebody you don't know and trust set up one for you. If someone approaches you and says, yes, I can do that for you, but you don't really know who that person is, don't do it because there's some confidential information on your Medicare.gov account. So don't let somebody, volunteer to be your trusted confidant unless you're comfortable with them seeing that information. That's why I always say it's better to have a family member, get your son, your daughter, your grandkid, somebody like that that you trust and you know you can trust to manage that for you if you want. But it is a great way of keeping up with that information in a faster way. Then last, we want you to report anything that looks funny to you. We want you to gather all the information in the documentation. If you've got your Medicare summary notice information, whether you got that from Medicare.gov or your paper Medicare summary notice or an explanation of benefits, then we want you to get your healthcare journal or whatever you're using to keep your records. And then first, call the service provider, call the people that you went to and say, hey, according to my records, I didn't see you on that date, or I didn't get that knee brace, or whatever the case may be. Something looks wrong. Can you check that for me? And if it's a real mistake, they'll fix it. They'll make it right. And then you need to watch your records in the future to make sure that that correction shows up the way it's supposed to. But if something still seems fishy to you after you talk to that provider, we want you to give us a call. There's our information, our phone number, and our website, our email address. Uh, Give us a call, talk to us. We would much prefer that you call us, even if it turns out not to be fraud. We'd rather know about it and help you get this resolved. Now, here's some tips. Let's go over this again. I know we're a little bit over. Medicare and the other government entities will not call unsolicited. If somebody calls and claims to be from Medicare or Social Security and you're not expecting, in other words, you didn't call them and say, please give me a call, they're not going to call you. Don't carry your Medicare or Social Security card with you. Track your medical information in your healthcare journal or some similar record. Some people already have something that they use. That's fine as long as you're keeping good, accurate records. Establish a code word or a phrase to securely confirm the identity of a family member on the phone. If you've got, family members that might be calling you, and if they're if you're going to have that kind of a relationship, they might call and ask you for money, maybe, or something like that. Set up a code word. Verbally confirm any text messages. If somebody calls you and they're asking for information, like your credit card number or your date of birth or something weird like that, it's always a good idea to not respond to that text message and then call your daughter and say, did you just call and ask for my birth date? And then you can say, why don't you know my birth date? Anyway, no, I'm kidding. But it's a good idea. Don't put information on a text message or an email because sometimes people can spoof those a little bit. They can change them a little bit, and you may think you're talking to a family member or a friend, but it's not really them. Don't pay anyone or any entity with a gift card or a money order. There's been I'm getting lots of things right now claiming that I have traffic violations and things like that. And they're telling me that I need to pay those immediately or I need to click on this. Don't fall for those, folks. Those are scams. And when in doubt, give us a call, 405-521-6628. Want to introduce you guys to Edna Scamwhacker. She is a feisty fraud fighting senior and she is tired of these scams just like we are. Edna is a new character we've got and we're using her to help us educate seniors about fraud here in Oklahoma. So you've probably seen some of the commercials on TV already and you'll be seeing more of Edna as we're introducing her to Oklahomans and asking her to help us fight fraud here in Oklahoma. So please stay tuned. These are our partners here in Oklahoma that we have contracted with to help us with this fight. So if you live in one of these areas and you'd like to talk to one of these people, please reach out to the agency in your area to learn more. And now it's time for questions. Wyatt, do we have any questions?
I don't see any in the chat, and I just want to remind everybody that the webinar is being recorded and it'll be available on OID's YouTube page and at map.oid.ok.gov. And then after the webinar, if you think of any questions, you can call us or you can email them to map@oid.ok.gov.
Okay. Folks, I appreciate you joining us today. Please remember, it is Medicare Fraud Prevention Week. I know there's a lot of you on here that aren't on Medicare yet. Please take the time to call someone you know that is on Medicare, educate them, talk to them, make sure that they know what they need to be doing to protect themselves. There's nothing worse than having to talk to somebody who feels that like they've been violated due to Medicare fraud. Some of the things that we're hearing are quite sad, and we don't want anyone to be a victim. So please take the time to go out and educate those people around you. And thank you for taking the time to join us today. Have a good day.